Introduce you to our panelists. We have Seema, my parents, and Ashish with us. And so I'll ask them in that order to introduce themselves.
Hello, good morning, everybody. I'm Seema Nair. I'm a registered holistic nutritionist. So today our topic of discussion will mostly be on vitamin D. What are the deficiencies you will have when you are deficient in vitamin D, and how vitamin D plays an important role in your life. So let's start the discussion.
Thank you, Dr. Sapan. Thank you, Seema ji. It's a very informative and useful talk. It's great help both of you are doing. Thank you so much. Hello, namaste to everyone. Thanks.
Well, in India, things are under control so far, but the cases are increasing speedily. Looks like a second wave is coming. And this time around, the weather here is very pleasant, maximum 35 degrees, and it used to be touristic season at this time. But last year went by like that, and this year also, I think it is going to be. Is fingers crossed. So let us see. Thank you.
Thank you.
Good morning, everybody. My name is Ashish Kotial, and I have joined from Toronto. The weather is perfect, getting warmer. It's around 11 degrees, and yesterday was the first day of spring, and I would say spring has sprung. And today's topic is perfect one. It's bright, sunny, and a lot of sunshine to get vitamin D. Look forward to hear from Seema ji and Dr. Rawat.
Great, thank you very much. So let's start our presentation. I'll start by sharing my screen. On the YouTube video, I will be putting chapters, so you will be able to skip the introduction and go straight to the talk. And you will be able to go straight to my talk and go straight to Seema's talk as well, which is a new addition. So please do check out the video on YouTube as well, and I'm sure you'll enjoy the chapters part. So today we're talking about vitamin D, skin color, and COVID-19. So vitamin D is a very important vitamin. In fact, a lot of, we now feel it's not even a vitamin. Vitamins are usually cofactors. So these are nutrients that we require for certain processes to happen in our body. But now it is recognized that vitamin D is more than just a vitamin. It is, in fact, a hormone. It is similar to a steroid hormone. So the differentiating factor here is that vitamin D goes into your cell, but also goes into the nucleus of your cell and makes certain DNA changes so that you express different types of proteins. And hence, it is more than just a vitamin. Vitamin D is a hormone. Primary source is through sunshine, in fact over 90%. But you do need the sun to be above a certain angle in the sky. So it would typically be sun exposure between 10 a.m. and 3 p.m. which produces vitamin D. And also, sun exposure through the glass of a window will not give you vitamin D. It has to be direct sunshine. The type of vitamin D which you get through the sun, i.e. processed through your skin, is vitamin D3. You can also get vitamin D2 through consumption of vitamin D in the diet, which is primarily oily fish, egg yolk, fortified milk, etc. But how you cook the food is also quite important. For example, when you bake fish, you're preserving most of its vitamin D content. However, if you fry fish, you will be reducing it by more than 50%. In most cases, vitamin D deficiency is asymptomatic. In children, it can manifest as delayed walking, bowed legs, or recurrent infections. Adults often get chronic recurrent pains, aches, tiredness, and other kinds of non-specific symptoms. Of course, we know that vitamin D has several roles within the body, including strength of your muscles and bones, reducing inflammation, it's an immune modulator, reducing cardiovascular disease, certain types of cancers, and also has a role to play in memory and neurological function. As an example, this meta-analysis below showed an inverse relationship of vitamin D levels and cognitive decline in multiple sclerosis patients. So those patients with multiple sclerosis who had low vitamin D levels, they tended to have more disability and cognitive or memory function decline over time. So anyone who is interested in that study is welcome to read it from my blog. The links are all below. I've got some UK studies, statistics which show that prevalence of vitamin D deficiency in adults is about 14.5%, above the age of 65 more than 30%, and in otherwise healthy South Asian adults in the UK, so here we're talking about dark-skinned people who have migrated to the northern hemisphere, as high as 94%. Of course, it is much more common in winter and spring compared to spring, summer and autumn, because you have long winters where you get very less vitamin D. Usually if a patient gets vitamin D deficiency diagnosed through a blood test, I would treat them with a loading dose, a higher dose of about, in my practice it would be something like 5,000 to 6,000 units a day for 2 months, followed by a maintenance dose. In my practice, around about 2,000 units a day for an adult. Of course, you do have to make changes according to age, other medical conditions such as kidney function, weight, and so you really need to seek advice from your own physician for your exact dose. It's interesting that the kind of vitamin D you get through the sunshine will last double the time that you get through food and supplements. As an example, if full body exposure to sunshine gives you a slight tan, then you're likely to be getting more than 10,000 IUs of vitamin D. However, skin pigmentation, i.e. darker skin aging, which is older skin, and the use of sunscreens will reduce the amount of vitamin D that your skin can produce. Just to highlight the importance of vitamin D, let's quickly talk about skin color. So, some of you might know about Cheddar Man. This is Cheddar Man. Cheddar Man essentially was a fossil or a Briton found in Great Britain, whose remains were found in Great Britain, and he lived about 10,000 years ago. An analysis was done of his DNA, which showed that he had black skin. So that explains a theory, a hypothesis which was already out there, that all of us humans initially started off around about Africa and migrated to other parts of the world. However, we needed a good amount of melanin, skin pigment, to protect us from harsh sun. Over time, however, as we moved to other parts of the world, we didn't need as much melanin in our skin, because in fact it was the opposite. We required less melanin because we needed to absorb more vitamin D. And over time, those of us who lived in parts of the world where there was less sun lost our skin melanin pigment. So we got depigmented. And the whole thing that we talk about, we identify ourselves with our skin color. We may call ourselves black or brown or white. But this is all Darwinian evolution, which has allowed us to maintain adequate vitamin D levels. That's all it is. So scientifically, there is really nothing more to it with skin color than the human being's necessity to maintain adequate vitamin D levels. Of course, with migration then, there have been some issues which have evolved. This is Dr. Jablonski from Penn State University who explains this hypothesis very well. Of course, there are other issues which have cropped up. So, white people who've moved to very sunny areas like Australia have a higher incidence of sun damage and skin cancer. In fact, Australia and New Zealand have the highest incidence of skin cancer in the whole world because their skin is not adapted to the harsh sun. They don't get sufficient protection from melanin. And the converse is also true. Those of us who have darker skin, which means we are less susceptible to absorb vitamin D, absorb sun and produce vitamin D, and are living in environments where there is less sun, either we are living indoors most of the time, or we're getting most of our sunlight through the window, or we're living in the northern hemisphere or the southern hemisphere away from the equator, are then more susceptible to get vitamin D deficiency. So let's now talk about the epidemiology of vitamin D deficiency. This was a study which looked at human activity patterns, a large study, and what they came up with was that about 7.6% on average of our day is spent outdoors. Now hopefully spring is coming and summer and we can all improve that. But as a human race, over time, as we have moved away from farming, agriculture, to more indoor sedentary lifestyles, we are just spending less and less time outdoors. This study here shows that as we get older, the capacity of human skin to produce vitamin D reduces. That's also very important because elderly are particularly high risk of vitamin D deficiency. This study here showed differences in vitamin D bone health within races. The darker your skin is, the more likely you are to be deficient in vitamin D. This study shows that obesity reduces the bioavailability of vitamin D because vitamin D from the skin then has to be metabolized through your liver and other parts, kidneys as well, and then becomes available as a bioactive vitamin D. And if you're obese, then the availability of vitamin D will be reduced. This interesting study here, which is a mice study, showed that long-term high fructose intake, and isn't this so interesting? We talk about high fructose corn syrup in our talk last week about fatty liver. We talked about it 3 weeks ago in our talk about obesity. We talked about high fructose corn syrup in our anti-inflammatory talk over a month ago, as it is a significant inflammatory agent, causative for insulin resistance, causative for fatty liver, causative for obesity. It also causes vitamin D deficiency. Who would have seen that coming? So these are all the kinds of things which could lead to a person having less vitamin D. So patients who are having more fructose, who are obese, who are older, who have darker skin color, they all need to be mindful of all of these risk factors and understand why it may be that they are vitamin D deficient. So let's now talk about respiratory disease and vitamin D deficiency. There was a study which was a 15-year observational study of 10,000 people, which showed that those people who had higher vitamin D had lower mortality from respiratory disease. So a large 15-year study which demonstrated that if you have a higher vitamin D, there was an association with less death from respiratory disease. Of course, I must explain to those who are non-medical here that there is a difference between association and causation. Association does not necessarily mean causation. There may be other associations, there may be other reasons why there is that association. As an example, those with higher vitamin Ds may be more outgoing, they may be doing more exercise, they may be looking after their health better, they may be taking more supplements, and that might be why they're getting less respiratory disease. That's an hypothesis. So I just like to point out that observational studies they pick up patterns, but they do not pick up causality or causation. There's this other study, which is a meta-analysis of 25 studies published in the British Medical Journal, which showed that vitamin D supplementation reduced incidence of respiratory disease, which is this study here, which was published in the BMJ, which was a big meta-analysis of 25 studies. Again, same kind of pattern picked up. In Japan, they tried a randomized control trial, rather small trial, in which they gave vitamin D supplementation to school children and swabbed them for influenza A, flu virus. And it did show that they were able to significantly reduce the amount of flu that school children had when they were given vitamin D supplementation. Although it was a small study, admittedly. So let's move on to COVID-19. I have a study here which showed that lower vitamin D levels were associated with more positive swabs for SARS-CoV-2. So they compared cohorts of patients who had positive swabs against controls and found that there was an association there with vitamin D levels, an inverse relationship. This is a large observational study of 200,000 patients, which again showed an association that increased SARS-CoV-2 positivity was associated with lower vitamin D levels. That would be this study here. A big study, 20,000. SARS-CoV-2 positivity associated with circulating 25-hydroxy vitamin D2 levels. Now let's move on to acute COVID-19. This was a hospital-based observational study in which a lower vitamin D level measured on admission to hospital was associated with a worse progression and also associated with higher blood clotting and D-dimer levels or inflammation levels. As we discussed earlier, vitamin D is something that we associate as an immune modulator and an anti-inflammatory. So in this study of older patients with COVID-19, having a lower vitamin D at admission was associated with more inflammation, more blood clotting, and a worse outcome. This was a pilot RCT in which an injection of vitamin D, so not a tablet, was given to COVID-19 patients. And the good thing about the injection is that it's rapidly bioavailable. The trouble with the tablets we give you for vitamin D is that it takes about a week for that to be converted through your liver and your kidneys into bioavailable vitamin D, which is one reason why vitamin D tablets as such have not been particularly successful at fighting COVID-19, because it takes too long for that to turn into an active agent. In this case, an injection of calciferdiol, which is a bioactive vitamin D, was given, and there was a reduction in ICU admission in this small randomized controlled trial. I believe it was done in Spain. That's correct, it was done in Spain. And again, this was a small RCT which was published in the BMJ, which also was associated with lower inflammation levels, lower blood clotting levels in those patients who were given high doses of vitamin D. So this is the Spanish study. This is the other study. BMJ is a reputed journal. This was done in India, in fact, in Chandigarh, and patients were given high doses of oral vitamin D, and it did reduce blood clotting levels, inflammation levels, and outcomes in that study done in Chandigarh. And so I would like to point out that, of course, I have my own protocol to treat early COVID-19. There's one for North America, there's one for the Indian subcontinent. And so vitamin D does feature. And hopefully, through today's talk, it now makes abundant sense to everyone why vitamin D is there on that protocol. Let's finish the talk now just by going quickly through the protocol. There has been a resurgence of COVID-19. I have come across some patients now in Mumbai. As we know, Maharashtra is the capital of COVID-19. So I will now pass over to our nutritionist, Seema.
Thank you.
Thank you for listening. We'll have question answers at the end. So Seema, if you can just take the stage now. Thank you.
Yeah, let me present.
Well, I would also like to just invite, I can see people watching on YouTube as well as Facebook. I would like to invite anyone who would like to ask questions to feel free to type them in, and we'll be happy to answer those questions at the end. Seema, that seems to be working. I can see your presentation. Thank you.
Yeah. So, today the topic of discussion is on vitamin D, the sunshine vitamin. Now, vitamin D is one of the 13 vitamins that was discovered in the 20th century by doctors studying nutritional deficiencies. So, ever since scientists have defined vitamins as a organic, that's the carbon containing chemicals that must be obtained from dietary sources because they are not produced by our body's tissues. Vitamin play a crucial role in our body's metabolism, but only tiny amounts are needed to fill that role. Vitamin D is a fat soluble vitamin. What is a fat soluble vitamin? So fat soluble vitamin, it requires bile and dietary fat for absorption. Once it is absorbed, they are transported with fats through the lymphatic system in the chylomicrons before entering the blood. Fat soluble vitamins can be stored in body fat, meaning that intakes can vary without a risk of deficiency, as long as there are average intakes over time. Because they are stored in the body fat soluble vitamins are not easily excreted. This increases the risk of toxicity with high intakes of vitamin D. So, are you getting enough sunshine vitamin? So, vitamin D is often referred to as a sunshine vitamin because it is the only vitamin that can be synthesized by our skin in the presence of sunlight. The inert form of vitamin D is then converted to two active forms by the kidneys and liver so that it can be readily used by the body. During summer, our bodies will produce an adequate supply of vitamin D as we spend time outdoors. Since we don't get enough sun exposure to sunlight during the winter months, it is always important that we receive a daily requirement of this important vitamin through our diet. So, what are the effects of vitamin D on our health? So, what it does, it improves our heart health, it increases our bone and muscle strength, it improves our mental health, improves our respiratory health, and improves our gut health. So, vitamin D plays many roles in the body. This vitamin is a bioactive form and is responsible for many things, like promoting absorption of calcium, which is needed for the growth and development of the bones and teeth, promoting absorption of phosphorus in the food, which is needed for proper neuromuscular function, enhancing the immune system, and therefore reducing the risk of infection and disease, reducing inflammation, regulating cell growth, maintaining a good bowel and bladder health.
Seema,
Now,
one second. Seema,
yeah.
we are still on the first slide. I don't know if you've been moving have you been moving the slides?
No, I have been moving. I'm on the third slide now.
We can only see the first slide.
Is it? Okay.
Maybe try the screen. I'm not quite. Okay, now I can see the other slides. Okay, now it's working. Great.
Okay.
Thank you.
Okay, so the role of vitamin D, how vitamin D plays many roles in your body. This vitamin in its bioactive form is responsible for promoting absorption of calcium, which is needed for the growth and development of bones and health, promoting absorption of phosphorus in the body, which is needed for proper neuromuscular function, enhancing the immune system, and therefore reducing the risk of infection and disease, reducing inflammation, regulating cell growth, maintaining a good bowel and bladder health. So, how does your body make vitamin D? The sun's energy turns a chemical in your skin into D3, which is carried to your liver and then to your kidneys to transform it into a more active vitamin D. So what does it do in our body? It regulates calcium and phosphorus level in the blood, promotes bone formation and mineralization, inhibits the parathyroid hormone secretion, and affects the immune system. Now, the symptoms, there are some symptoms that show when you have a vitamin D deficiency, like fatigue, digestive problems, immune impairment, joint health, dry skin, high blood pressure, mood swings, overweight, and excessive sweating. So, vitamin D deficiency is usually the result of lower than recommended intake levels, limited exposure to sunlight, or inadequate absorption by the body. Deficiency in vitamin D can cause headaches, difficulty sleeping, muscle fatigue, muscle cramps, low immune function, rickets, a condition where the bones are soft and there are skeletal deformities in infants and children, bone pain, joint pain or swelling, osteomalacia, abnormal weakening of bones in adults. Now,
Seema,
most who are at the risk of vitamin D deficiency
Seema,
are
we are still now on
pregnant.
that. We are on the 20th century doctor slide now, for some time.
20th century.
Now it moved. Now it moved. Yes, keep going like that.
Okay.
Just keep clicking on this the relevant slides. Yes, thanks.
Okay. Now you can see, right?
Yes.
Okay, so who are at the most at the risk of vitamin D deficiency? Those are at the risk of vitamin D deficiency include exclusively breastfed infants. So breast milk alone does not meet the required daily intake. Elderly, aging skin does not effectively synthesize vitamin D. Then obese individuals may need more vitamin D than an average size person. Those with limited sun exposure, those with colored skin, especially dark skin. Increased levels of skin pigmentation called melanin reduces the skin ability to produce vitamin D. Those with conditions that result in fat malabsorption. Now, those with the limited exposure to sunlight need to supplement their diet with vitamin D rich foods and supplements. So, vitamin D is naturally present in some foods such as seafood, added to other foods such as fortified cereals, as and also available in the supplement form. So, some good food sources of vitamin D include salmon, mackerel, tuna, sardines, then beef liver, egg yolk, cheese, button and shiitake mushrooms, fortified milk, yogurt, soy milk, fortified cereals, fortified orange juice, fortified tofu. Exclusively breastfed infants, the elderly, and those with limited exposure to sunlight should include a dietary supplement of vitamin D in their diets. Infants and younger children are required a vitamin D supplement of 400 IU daily, and older children and adolescents can be given 1000 IU daily. It is always best to ask your doctor before you start including a supplement in your diet. So it also depends on the blood test that will let you know that you have a vitamin D deficiency, and based on that the doctors will recommend you the amount of IUs that you need in your as a supplement. As with supplement, it is important to follow the instruction and administer the correct dosage. So overdosing for a prolonged period of time can result in vitamin D toxicity, which can lead problems such as weight loss, anorexia, damage to the heart and blood vessels due to excessive levels of calcium in the blood, arrhythmia, that is irregular heartbeat, kidney damage, polyuria, excessive production and passage of urine. Now, research has also shown that vitamin D plays a role in the prevention of colon, breast, and prostate cancer. Research has also shown that vitamin D plays an important role in the prevention and possible treatment of diabetes, glucose intolerance, high blood pressure, multiple sclerosis, and depression. So what can vitamin D do? It can reduce your risk to flu, reduce your risk to cancer, reduce chronic muscle aches, reduce your risk to cardiovascular disease, reduce your risk of depression, reduce your risk for developing diabetes, reduce your risk for getting autoimmune disease, and reduce your risk of osteoporosis. Some symptoms that you have low or high vitamin D is you have darker skin, so you would need more exposure to the sunlight. You feel blue. Studies show that people with osteoporosis have low bone density. Since we need vitamin D to help us absorb calcium, doctors and scientists generally believe you need to get enough calcium and vitamin D throughout the life to develop a healthy bones and reduces your risk of developing osteoporosis. Osteoporosis Canada recommends routine vitamin D supplementation for all Canadian adults year around. Now, some important takeaways. Sunlight is the best source of vitamin D. So, 10 to 15 minutes of direct exposure to sunlight provides the full recommended daily intake of vitamin D. Wearing sunscreen with SPF inhibits the skin's ability to produce vitamin D. UV radiation is a carcinogen responsible for skin cancers, and so exposure to sunlight without sunscreen should be limited. Contrary to the belief, vitamin D cannot be synthesized while exposed to sunlight indoors or in the car because the UVB radiation in the sunlight cannot penetrate the glass. Prolonged exposure of sunlight does not cause vitamin D toxicity. The body only synthesizes the required amount to carry out body function. Osteoporosis, although associated with insufficient calcium intake, can also result due to inadequate vitamin D intake over a period of time. Vitamin D is required for calcium absorption. So these are the important takeaways. Thank you.
Thank you.
Thank you, Seema. You can stop the presentation now.
Okay.
Thank you so much. So, I would like to just make one point. We have said a lot for vitamin D, but I would just like to just repeat once more that there is a difference between association and causation. Certainly vitamin D is good for us. Some of those things may be cause association, not causation. So, for example, when we say vitamin D is good for depression, it may be that vitamin D has some cellular function to reduce depression, but it's also very likely that people who go outdoors, who are outgoing people, are likely to have that kind of behavior pattern, who will not get as depressed as people who stay indoors all day. So there could be an association there as well. But in any case, it's good to pick up on all the associations and all the causations that there may be. Perfect. So let's thank you so much, Seema. Let's move on to parents and Ashish for their comments and questions and their feedbacks.
Do you want me to start or?
Yeah, start.
Go ahead, Ashish.
Thank you, Seemaji, and thank you, Dr. Rawat. It was very informative. I have a, it's vitamin D. I have found it's such a subject where nobody knows how much is sufficient or where the deficiency starts. So I have a number of questions, and the first one is, how do we determine that our body has optimal amount of vitamin D? Because as Seemaji mentioned, if you increase the vitamin D intake, it leads to more calcium absorption, and calcium toxic becomes, it increases toxicity. So how do we know that it's an optimal one? We go for annual checkup and they say, yeah, your body is okay, vitamin D is okay or not. Is once in a year sufficient, or do we need to do more frequent testing?
Okay, let me have a crack at that question first, and then Seema, you can have a go. Okay. So first of all, the maximum frequency of testing has to be 6 monthly, not more than that, because it takes about 6 months for it to build up into your system anyway. So there's definitely no point testing any more often than 6 monthly, but annual testing is generally sufficient. It's a very easy answer, depending upon the units that you use in your country. So I would also remind people that the units used in Canada and UK are different to the units used in US and India. So just be very mindful of the units you talk about. In Canada, it is something like between 75 to 250 is an adequate range. And as long as you're not going above that 250, then it's virtually impossible for you to get any toxicity. Also, if a person chooses to not have the test, because of course it is not OHIP covered, then generally speaking, we say as long as an adult takes no more than 4,000 IU international units a day, the chances of getting toxicity is extremely small. But if you do take more than 4,000, and there are patients who do need more than 4,000 a day, those patients should certainly be checking their kidney function, calcium levels, and vitamin D levels perhaps every 6 months or so, if they're taking higher doses. Up to 4,000 IUs a day for adults is generally considered quite safe. Seema, do you want to have a go?
So it's always good to have a vitamin D blood level test every year or every 6 months, because the thing is, in Canada, at least because of the winter weather, people don't during the winter their vitamin D stores are comparatively less as compared to that in summer, right? So people, what they do during summer, they don't supplement with vitamin. That is what I have seen. They don't supplement it with vitamin D, thinking that the sun is enough. But still, during summer, you need some supplementation. That is what I feel. Because personally, winter, it is very tough. We don't, we the thing is, there is sunlight, but the body is not able to take it, right? So it's always better to supplement it. Also, with the doses, it all depends. Like, for everybody is different. For some people, so for a dose of 4,000 to 5,000 IU is okay, but more than that, only if the doctor is recommending that, yeah, you should take 10,000 IU, then you can take it. Unless and otherwise, I think you should not have more. Like, only for 4 to 5,000 is okay.
So now, how long can our body store vitamin D? Is it something like in Canada, March to September, you have a good sunbath and vitamin D, would it be sufficient for you to carry over the winter? And like, I go to my doctor and she says that you don't need vitamin D supplement because your body has sufficient vitamin D. So it's a personal one, but my question would be, how long can we store this one? Can we store it, or it's a daily intake?
The thing is, yeah, the thing with vitamin D is, during the summer, you are exposed to the sunlight. At least for a few months, your body is able to store it. But the thing is, when you are always indoors, that is when the problem comes, right? If you're always exposed out, the thing is, at least I think the body can store that vitamin D that you're getting from the sun. But every time, for my own personal experience, I've seen during summer, I just take like 1,000 IU, and during winter, I take 4,000 IU. But still, when I go to the doctor, I do a vitamin D deficiency testing. I am deficient still. So what I feel is, you have to supplement it in some way. You should have that. That is not enough.
Yeah, I agree. Also, something very interesting, there was a lot of association shown of vitamin D reducing respiratory disease, reducing cancer, cognitive decline, etc. But a lot of those studies show those benefits if vitamin D was given daily or maximum once a week. In studies where vitamin D was given at bigger intervals, like in India, often they get 60,000 units once a month,
Yes.
or in England, you would get 300,000 injection every 3 months. Those regimes did not show the benefit that the weekly or daily regime showed, which is why we are now moving to either daily or maximum every 5 days or every 7 day regimes, because it seems that those very high doses given once a month or once every 3 months don't have the same benefits as the daily or the weekly regimes.
Yeah, I have based on this. So my mom, she always takes every Friday the vitamin D, as you told, 60,000 some I use. She just takes that, and then she takes it weekly. So she was asking why I cannot take it daily. So in India, it is like that. I don't know, is it for everybody or is it like for the seniors? Taking a dose that is concentrated, how your body is going to react, right? With too much vitamin D at the same, right? So I think it's better to take a little by little every day of vitamin D. That
That's
is what
right.
I feel. Yeah.
Also, bear in mind what they have. Often, what they will have in India is D2, not D3. So often, what you will find is 60,000 units may not be vitamin D3. It might be a vitamin D2. So it is not biocomparable. That's something else to look
Okay.
out for as well.
Thank you.
Okay.
So now you mentioned that in your presentation you need biles and fat for our body to absorb vitamin D. So someone who doesn't have or their gallbladder is removed, would they have to how then only sunlight or vitamin D supplement is the only option for them?
So the thing is, they have to take externally. They have to take bile salts for that as a supplement. So that will help in the digestion of this vitamin, like to process the vitamin D, right? So people whose gallbladder and all is removed, they will need that bile salts. Like some supplements, they have just the bile salts. So before taking vitamin D, they need to take that
Okay, thank you.
for absorption. Yeah.
Thank you.
And also vitamin D is in different forms, right? It's in a pill form, it's in a liquid form. You have to find out what is the carrier. Like some vitamin D has a carrier as coconut oil, so already you have the fat along with vitamin D, so the absorption is optimal, right? So that is how there are so many different varieties, right?
Yeah, a lot of fish oil capsules also contain some vitamin D, although not a large amount of vitamin D. But I would also say, the proof is in the pudding. Ultimately, it's a blood result which tells you whether they're absorbing it adequately or not. Not having a gallbladder would not completely stop your bile production. You will still have some bile production. Gallbladder is only one part of the biliary tract,
Yeah.
so you will still have some bile. So if the blood tests are, showing deficient despite supplementation, then certainly you may need to consider bile salts and that kind of thing.
Thank you.
Let's see if parents have any questions.
Thank you so much for very useful information to both of you. Thank you so much.
My question is, which form of vitamin D is the best? Natural form from our diet or from supplement?
The thing, see, the natural form is always the best, but the thing is, in that natural form you are not getting it. That is a problem now, right? So people don't want to go in the sun. They think, oh, when I go I will turn dark. I don't want to be in the sun for longer period of time, right? So the limitations are, natural is always good. That is what I feel. But because of these limitations, we have to take the supplement. Because the
every
thing
day
is,
for
when
half
you
an hour.
don't address these things, you always see that you have aches and pains all the time, right? Once you know that something is wrong, like the aches and pains are there, you, the 100% you know that it's some deficiency is going on. Personally, I have seen for myself, because a few years back I had a plantar fasciitis pain, and then they wanted to put that ortho in the shoes and everything. Nothing helped me. And then one of my friend told, you have to do a vitamin D blood test, find out your vitamin D levels, are they optimal? Once you achieve that levels, you think like it will whatever else you do, it will work for you, right? So you have to find out.
And I'm telling you, brown skinned people like us who move to the northern hemisphere, this is a problem. I remember I moved to England in 2002, and within a few years of moving to England, and I was a junior doctor, I wasn't really aware of these kinds of things. I started having to take more and more Tylenol or Crocin or paracetamol just for general pains, back pain, neck pain, all over pain. And I was thinking maybe I'm working too hard. In those days you're doing night shifts and all kinds of shifts. And there came a time when I was taking 6 paracetamols or Tylenols every day, 6 or 8 even. and it was just becoming a bit, I'm thinking, why is this happening? I must have, and then it just struck me this probably vitamin D. I started taking vitamin D. I didn't test myself or anything. In those days, we didn't even do much vitamin D testing because vitamin D really, it was one of those things. In those days when all the Asian people would come with multiple aches and pains, and you would diagnose them with a psychiatric problem. You would say, "Oh, this is typical Asian people. They're always complaining of aches and pains." Yeah, this is what
Yeah,
happened.
it's in the brain.
Yeah,
It's in the brain.
just 15 years ago, vitamin D wasn't even a concept, and it struck me that probably it is vitamin D. I started taking supplement. Within a few months, the pains were gone. I just found I'm not having to take 6 or 8 Tylenols every day just to get through the day. And so, but it comes very insidiously. It comes very slowly, creeps up upon you, and it's not like an acute illness which suddenly comes upon you. It comes up very slowly. Answering Daddy's question about best form is interesting. There was one patient of mine who he had severe vitamin D deficiency, so his levels were undetectable. They could not even find any vitamin D. So sometimes the report will say less than 15, which means it is somewhere below 15. We don't know where it is. So I told him, you're severely vitamin D deficient. This is what you have to do. He says, no, doctor, I'm against any tablets. I don't want to take anything, any supplements. I will not take anything. Tell me a natural way to do it. So I said, okay, fine. What do you do? He said, I'm working in IT. So how long do you work? I'm working from my computer, 12 hours a day. So I said, I'll tell you what you have to do. You have to stop IT. You have to become a farmer. Go back to India. Do farming. You do farming all day. Your vitamin D level will go up. So that is the paradox. Surely we would like to be natural, but the way we have chosen to live our lives means that we will not be able to get what our ancestors were getting because they had a very different lifestyle. And this is very similar to when we talked about fatty liver, when we talked about insulin resistance, the thrifty genes. Just a few generations ago, we were doing much more. We were much more outdoors. We were much more active. And now our whole lifestyle has changed. Within a few hundred years, our genes haven't changed. Only our lifestyle has changed. It takes thousands of years for genes to change. And so we have to then take supplements to adapt. Otherwise, there is really no other way of adapting. So, Daddy, any more questions?
Yeah, no, it is about dietary habits. In India, people are generally vegetarian, and I think vegetables do not have these vitamin D present in them. So, and the second thing is then they don't take meat, etc. And in milk also it is not present in sufficient quantity. So, what should they do in that case?
In that case, what I feel is taking some fortified cereals and all, which has vitamin D. Like if they don't want to take supplements like fortified cereal or fortified something that is fortified with vitamin D. So there are certain foods that are fortified, right? So basically you have to research on that type of foods and just include that in your food if you don't want to have a non-vegetarian food, right? So that is one thing you can do. And always being in the sun. Morning 10 o'clock, just go in the terrace, just stay there for half an hour. That's it.
Yeah, every day half an hour we are sitting in the
Yeah.
During see this is a COVID period and nobody goes out.
No, but we are going to the balcony. We are sitting in the balcony.
People are scared.
Yeah. Fear is one thing, right?
Yeah, but I would just like to add, there is a certain mentality that we have. If there is a street and the sun is coming at a direction, and let's say one part of the street is sunlit and the other part of the street is in a shade. I would like to describe myself as not having an Indian mentality in that sense. Typical Indian mentality, we walk in the shade, and typical Western mentality, they walk in the sun. Just observe on a street. Western people, they walk in the sun, they want to get as much sun as possible. Indian people, they want to get as much shade as possible. Because of taboo around skin color and so many other things that they feel about sun.
As you told about skin color, one of my friend nutritionist, she's in Dubai, she's working there, and she was asking me, the thing is in Dubai, it's like sunlight is always there. Like it's the place has lot of sun, but the thing is people are all vitamin D deficient. So she was asking me what is the reason. So I was explaining him, see the way they are when they go out, right? They cover everything. First thing, your body is not getting enough sun. Then the next thing is, if they are exposed, they will apply a lot of sunscreen. That also doesn't allow your body to make vitamin D. So there are so many factors, right? People don't want see the obsession for getting more brighter skin, right? That is one thing. You don't go in the sun. Like parents will tell their kids, don't go, it's not good for you, you will turn dark. So that, all that in the childhood itself, right? People have that thing, should not go in the sun, this will happen, that will happen. So that's the thing, it starts from that.
Seema, that's a very good point, and that's something I want to touch upon as well. I personally, when we go to the beach as Indian people, and I see Indian people lathering on sunscreen and thing at the beach, it kind of upsets me a bit, because I understand that for the white people, because their skin is sensitive, they don't have the natural sunscreen, brown pigment, melanin, which will protect them from sun damage, cancer. But we are much less likely to get that. We have that natural sunscreen, and just lathering their children with sunscreen at a beach is just going to lead to this kind of deficiency problem. And so, yes, that's a very important point, and we do have to get over those cultural norms and those taboos to also deal with this condition. And of course, Daddy, I will also, about that person, let's say, who doesn't want to take supplements. If we just think about all the risk factors we talked about in the previous slide. So we talked about advancing age, and there's nothing you can do about that. There are two types of risk factors, modifiable and unmodifiable. Advancing age is an unmodifiable risk factor, we cannot modify it. But we talked about obesity. If you're obese, because your fat absorbs vitamin D and makes less available to your body, you can reduce weight. That will increase vitamin D indirectly. We talked about high fructose corn syrup and high fructose diet. People who eat too much sugar, that also reduces the bioavailability of vitamin D. So all those cascades which take place where your skin vitamin D3 is converted into through your liver and kidneys into bioavailable vitamin D3, that is reduced and hampered by having too much sugar. So that is something else they can do. And if they're very strictly vegetarian but will accept a vegetarian supplement, then vitamin D2 is a plant-based vegetarian vitamin D. So that is something that they might find acceptable.
My last question, it may concern many of people, those who sit in the sun, but unexposed. They are fully covered and they sit in the sun and think that they are absorbing the vitamin D.
Yeah, the thing is, yeah, your skin has to be like your you should not cover yourself. Like at least like some part of your body should be exposed to the sun to make vitamin D, right? The minute when you feel that redness in your skin, that is when your body is producing vitamin D. But the thing is, when you cover your body, you are not allowing your body to absorb it, right? That from the sun. So it's always better, like at least 20 minutes, you make sure that you are in the sun, you are not you are exposed completely to the sun. And then, because I remember in olden days, they used to apply oil to small babies and they will put them in the sun to get that initial vitamin D. They will do a massage in the sun and they would keep the baby like for 20-25 minutes. And I think that really helped the babies, right, with their bone development and everything.
I would like to add here, because we're talking about babies, breast milk is deficient in vitamin D as well as iron, something to bear in mind. And children who are fed by their mothers for prolonged periods of time are also at risk of becoming iron deficient and vitamin D deficient. And so a lot of time I see babies, especially in the pandemic now, it's a big problem, very pale babies. And the parents are so gushing in joy. Look, look the skin color of my child, so fair. Both parents are dark, but the child is fair. That worries me a lot. That tells me this baby is one, that skin is asking for more vitamin D. When I see a very pale baby, To the parent, that looks like a very beautiful baby. To me, it looks like a very worrying sight. To me, it looks like that baby is asking for more vitamin D and probably iron as well. And a lot of these cases, the baby is hardly going outside. They're lathering the skin with lotions. They have all kinds of umbrellas and all kinds of hats whenever they go outside. And in addition to that, a lot of them could be breastfed for prolonged periods of time as well. And so these are all things to look out for. We do recommend the D drops, which is the liquid drop vitamin D for babies and children. So I do recommend once they're old enough to have chewable multivitamins, say about 3 years of age, 2.5, 3 years of age, I recommend once a day chewable multivitamin as well. Here you can get Flintstones, you can get Jameson's. Flintstones you can get with iron, or you can get it without iron. So it depends if there's a history or whether there was a risk of iron deficiency. More so if you're vegetarian. Vegetarian children, babies are more at risk of iron deficiency as well. So I do recommend for children generally chewable daily multivitamin with D drops as well. And I'll let Seema sort of elaborate on that as well.
Yeah, it's the thing is, when the baby is born, they always recommend that the baby should take vitamin D, like few drops of vitamin D. And then the thing is also, you have to make an active decision, like taking a baby outside in the sun for a few hours. That will really help the baby to get that enough vitamins. And exposing them to chemicals at a very young age, that is always a bad idea. Just because somebody is telling, oh, the sun is not good for your baby, people don't, they just want, yeah, the sun is not good, they will just apply the cream and everything. That is not a good idea, right? So it's always, parents should have that thing, right? Yeah, we have to read more about what are the ingredients, especially the chemicals what they're using to make that sunscreen, right, for babies and all. There are some sprays also we get nowadays. You just spray it all over, and then you it doesn't matter how long you're in the sun, it won't have any effect on your body. But internally, I don't know how it is affecting your kidneys and your liver, right, internally. So people don't care. They have to make a informed, like they have to do more research about all these things. Yeah. And they always say that it's always better to apply some coconut oil and all, if you think, or aloe vera gel before you go out, like natural ways of, if you feel that, like for some people sun is really a very big problem, so it's better than they apply aloe vera gel or anything before they step out. So something that is natural. Yeah.
Yeah, I mean, we've become so protective of our children. It can be harmful for them. So as an example, you look at the cars, the shades on the cars, you can't let any sun get into the eyes of the baby. The eye of the baby will get disturbed, and even the hygiene standards we're maintaining, I mean, a bit controversial, but we've made everything so hygienic and so sanitized that the babies then don't get exposed to any mud or dirt or any of the natural substances. And there are theories that that's leading to more allergies, because they're not getting exposed to those food substances early on and other kinds of allergens early on. Later on, they're developing more severe allergies. There was a study in which they followed a small group of very, these were like royalty babies who never been to a daycare, never been to a school. Everything was done in their palace. And they found that those later on in life, they developed more cancers, particularly more leukemia, because the immune system had not developed to fight infections, to fight dirt, and to fight other things. As a result, the weaker immune system could not suppress cancers later on. So we have to be mindful. When we get into that very super hyper protective mode for our children, we have to be just careful that we are not causing them harm in the longer term. So we have to be mindful of those things.
Yeah.
Ashish, do you have any questions at all? Any more questions?
I have one question, but another one is, it's anything which increases our weight, lifestyle, we have made it as a villain. So nobody want to eat cheese, nobody want to eat paneer, nobody want to drink milk because, we're going to increase our body fat and weight. So I don't know about India, but here, fortified milks are the easiest way. I bring fortified milk for my kids, especially. That's the easiest one. My question was, does the timing of your test, makes it, or would it give a false result? Because if I go for testing, let's say in August, September, my body will have sufficient vitamin. And if I go for testing in January, February, I will be deficient. So what's a right time to do vitamin D testing?
What I think is it's better to do 2 times if you are able to do 2 times to see the difference first. Is the thing is around you told about August, right? August, September, and then somewhere around January, February. So I think what I feel personally is there will be two different results, because if you are active during the summer times, I think you will have the optimal levels. But as slowly when you see all the daylight savings and all change, and slowly you get into that winter season, right? You are not exposed too much to the sunlight. Slowly your vitamin D depletes in your body, and then you can find out like you will have some aches and pains, especially during winter time. That is what I have seen. The aches and pain, it starts coming during that time, not during the summertime, because we are all outside, we are just going here and there. But during the winter's time, you will start getting headaches, like seasonal affective disorders and everything, right? Aches and pains and everything. It's not that you are not active, but it's the, I think the depletion of the vitamin D is taking place around that time, during the winter time.
Yeah, I mean, personally, Ashish, I'm quite okay for you to test any time of the year. But as a clinician, I do tend to keep that in mind. So, as an example, at the end of winter, if your level was 75 and the normal level in the units we use in the UK and Canada is 75 to 250, I would be quite impressed with you. I would say you got through winter with a level of 75. That's not bad. I expect this to improve now as spring is coming. But if you had a level of 75 in September, then I would not be very happy with you. I would say, well, you've hardly got any storage of vitamin D, and what's going to happen with you over winter now? So I do bear in mind the time of year when the testing is done, when I look at a level.
So maybe staggering them is a good option. Maybe 1 year test them in January, and then next year, the following year, because it's expensive. It's I think around $40 we pay per person. It's not covered by OHIP. Yeah. Thank you.
Yeah.
Great. So, do we have any more questions, or are we done for today? I think we are done for today. Yes. Great. So, Mummy, do you have any final questions or comments, or anything you want to say at the very end?
Thank you so much, Sapan, Dr. Sapan, Simaji. No question, please. Thank you so much for great, very useful talk and very nice information, as always. God bless you. Thank you so much.
Thank you.
Okay, thank you so much. So, our next talk next week is already planned for high blood pressure. We'll be talking about high blood pressure. We're preparing a talk for high blood pressure next week. If there is something which is major in the COVID world which comes up, we might then push it to the week after and just do COVID. We are trying to do more and more talks which are non-COVID now, because we spent almost a year just doing COVID on its own, and so we are trying to do more non-COVID talks as well. But thank you to everyone. The video is on Facebook, is on YouTube. On YouTube, I will be putting chapters, so you will be able to scroll straight to my presentation, to Seema's presentation, and then to the question answer sessions. If you feel it added value, if you gained any knowledge, please share widely on WhatsApp, YouTube, Facebook, so that other people can also derive this knowledge. And we will